Mumene radio assistant so yina. Yada obi bia watimi aba program yi so mo bia akwa aba yesan da mu nyina amase. Ansa na yebehye dwumadi na se na yepam cho mo menkata yeni na ye sister atane mo mpaye. Ansa na yehye dwumadi na se.
Odumfo ni mobrohufo nyame batam kayeda wase sa yo pene nwumre so wa me abehia yɛba abɛsua wo ho adeɛ apɔmuden adesua ne yɛbɛsua yɛsrɛ yɛde ɔkasamafoɔ hyɛ wo nsa ma asɛm a wɔbɛka mfiri wo nyame ma ne nyansa a mu dɔ a wɔde bɛkyerɛkyerɛ ne yɛn nso yɛnya adwene mu dɔ a yɛde bɛte aseɛ yɛwie yɛde aseda ani kabea ma yɛda wase sɛ ɔbɛyɛ ne saa ma yɛwɔ adom no nti amen.
Amen. Yɛpam kyɛw sɛ wonim obi na wohu ne din wɔ screen no so a na wafrɛ no sɛ yɛastarte yɛ program no nti mommra so. Ɛnɛ yɛ dwumadie no yɛ sister Mrs. Jennifer Nimako ɛna ɛde bɛma yɛn ɔbɛka about diabetes. Na ansa na no wama yɛn Bible akenkan sɛm a ɔpɛ sɛ ɔde ne dwumadie no egyina so nti momma yɛn nyinaa yɛmfa yɛtwerɛ kronkron na yɛmbie nkɔ mebusɛm eti mmiɛnsa nkyekyɛmu a ɛyɛ mmiɛnsa ekosi enum no Proverbs 3:3-5 mekan twii no yɛwie bitumi akan borɔfo sɛ ɔpɛ a but yɛkan twii no momentie Awurade asɛm ɔse ma adɔyɛ ne nokorɛ nyaa wo fa kyekyere wo kɔn twerɛ no w'akoma pono so ɛna wobenya adom ne nimdeɛ pa Nyankopɔn ne nipa anim fa w'akoma nyinaa bata Awurade ho na mfa wo ho ntwere wo ho mu Awurade asɛm ni amen. Yɛnnwom a yɛbɛto de adi yɛ sister anim ansa na ɔde dwumadie no ama yɛn yɛbɛhu no memenda akɔ ahoyɛfoɔ nnwom no ahannum ne hold on 590 wrong one sorry hold on wait. Okay. Yeni nyame nantil nasem no haimu a nenyo nyam no shiren yen kwanso se ye yeni pe a oni yen bet nada ne won a obeti no nina Trino tieno na hotobini Yesu mo sense o betrino na wetieno Ayonko fa pemu yebetna nenim ho anase yebe nantil nichen yebe yenya osi na yakoni soma yerisuro na yebetieno Trino tieno na hotobini Yesu mo sense wo betrino na wetieno. Amen. Mepam chosa me yebijai ahadi ama ye sister Jennifer na ɔde ɛna adesua na ma yɛn.
All right. Good evening. I hope that Ubia Timinka. I just want to make amen.
Amen.
Okay. Me person may share my screen into some me just 1 second. Me patrol said Obi betting my permission to share a my PowerPoint now. That would be good.
Jennifer, my head Dante.
Oh, okay. Let me try again. It's not coming up. Okay. Try.
So I tried you. I make you another representative.
Okay. But you're moving screen now.
What's your mind?
Okay. All right. Okay. Still I'm moving.
I remind us.
Okay. All right. And yet, Melda, women's. Oh.
About screen PowerPoint presentation as a
Yes.
website.
Yeah, it's a PowerPoint.
No, I mean a whole website.
It's a website. Oh, okay.
Yeah.
How about now?
No.
Okay.
Still seeing the website.
Okay, I'm not sure why I emphasize it. Can you see it now?
Yeah, master.
Okay.
I used to ubi PowerPoint was not send work for share.
What's it? Estimate then?
Ubi PowerPoint no.
Mm-hmm.
To share.
Okay.
Share no copy you.
Yeah, that's what I did. But...
So we're gonna more hard time. I will bit me email my bit me so I am more.
Okay. Yeah, let me do that quickly.
Read the email to chat in mama.
Okay, thank you. If I try more yes, and any ever try him no so man tuning in because na me can save time, but I think ever say I start here to be. Yeni nyame nantil nasem no hai mu a nenyo nyam no shiren jen panso se ye pe a oni yen bet nada ni won a o beti no ni na trino tie no na hoto bini Yesu mo sense o betri no na wetie no Esumbiri sorry mununkumbiri si momenim til bepanina echinini ehun apinini nisu rimase trino tieno a trino tieno na hoto bini Yesu mo sense o betri no na wetie no Jerin swanie makwa Jerin rerin hukwa Nemum obetia yen sukapa Se amani mu o Se ebufu mu o Yetie no a obe shirajen na hoto bini Yesu mo sense o betri no na wetie no na yerin tu minya ni domu enika kosi se ye bejao ni nyinem ne dom a ochire ni di a odima wo won a wo tri no tie no di Trino tieno na hotobini Yesu musinse ube chirino na wetieno Ayonko fa pamu Yebetna nenim ho anase yebenantil niche Yebekonya osi na yakoni soma yerisuro na yebetieno Trino tieno na hotobini Yesu musense ube chirino na wetieno. Amen.
Amen. Thank you. Okay. Nti yebeda muniamase for your time this evening, and I yebesa that Women's Ministry for Department for allow me to speak today on diabetes. By profession, no me a family nurse practitioner, but right now no me focus it or have specialized in diabetes management. Into diabetes ho asem and I Diabetes is a very big topic, so for the sake of time, I've tried to just touch on the most important topics in diabetes. That way, I can save some time at the end, for some questions if you want me to answer anything. Into just to get some involvement from you guys, some mobile unmute me was some questions to be or statements be waha. And me kaya me pese ube answer say eye nokre anase enye nokre. And then we'll talk about these four kind of topics throughout the discussion today. And the first one is saying, I can't really have diabetes if I don't have any symptoms. Nti mpacho saa statement yi eye nokre anase enye nokre.
False.
False. Yeah. Pacho betimi aka why if you know. Okay. Go ahead.
Me feel say enye yare ni nyinaa na it shows symptoms nti no. Say if you're not having any symptoms, it doesn't mean say we need yare ni be na wo but no symptoms no na MPA.
Exactly. Yeah, thank you so much. And that's correct. Diabetes, I know who say hypertension is kind of silent. In TB say only symptoms are unless it be a blood work and you end up in the hospital. Most of the time people don't know that they have it. So thank you so much, Ata. The next one is eating too much sugar can cause diabetes. Is this a nokre and I say a
But you know, correct.
Yeah. Why do you say that?
But any sugar and it causes diabetes.
Mm-hmm. Yeah. And Rebecca Huasem, the sugar no can be a part of the reason, but is not the only reason why you can get diabetes. And I never caused diabetes, and I will explain that a little bit more. And the next one is that if I take my diabetes medication, I don't have to worry about my diet and exercise habits.
But you know, correct.
Okay, exactly. In fact, our diet and exercise when it comes to diabetes, weighs more than medication. Medication is very important, don't get me wrong. But I me catch my patients say a lot of the times 70% of management of diabetes really comes from the woody and our activity levels. That medications is about 30% of the puzzle. Into a lot of times, people will say, "Oh, I'll just take my medicine and I know, no." But then, still, our diabetes is not controlled. So clearly, no, enye edruning kwane here. And the last one is say diabetes can be cured with insulin. So anyway, correct, no correct, and enye no correct,
But you know, correct.
enye no correct. Yeah. So currently, no, diabetes does not have a cure. You can get into remission and now say they are very well controlled, but it doesn't go away.
it's always going to be there. Some people get it well controlled to the point where they don't need medication, but still, you should do blood work and follow up on it. Into your next slide, it really talks about the diabetes burden. Into right now, it's about 38 million people have in the US have diabetes. Into say nipa 10 and a room yemu baako will have diabetes. And as a nipa 5 a room yemu baako will have diabetes but does not know say they have diabetes. So you can see that that's a lot of people. That's very serious. And then we also have pre-diabetes. And also so it affects 98 million people in America, or more than 1 in 3 people. Into say nipa 10 will room na 8 of us or more can have pre-diabetes, but we don't even know that we have diabetes. I don't know how many people are on the line, but say say 10 of us you 8 can have pre-diabetes, but we don't even know that. Diabetes also is a very expensive disease to have. It costs a lot of money. For $13 billion for medical costs, and it be a lost work and wages no. And it's very expensive. And no also so about fine appointments in no. It can be very costly. Into a lot of things that you can do to minimize your chances to get it is good. But sometimes you do your best and you can still end up with it. And then also complications back from diabetes. And also, so I'll talk about that a little bit more on the slide. But I'll go to the next slide. Thank you. And see, what is diabetes? And again, I try to kind of just simplify this because maybe training, I can keep talking about this forever, but I'm just trying to just generalize it so we can just have some time to talk. And see, diabetes, no, it's a long-term health condition. Chronic, meaning say, it's progressive, it's happening over a long period of time. And what happens, they say, is affecting how a nipa process glucose, or glucose is also known as sugar, how our body processes that. And see, the way I am explaining to my patients, they say, well, no, if you don't have diabetes, I like right now say I don't have diabetes. My body tries to keep my sugar at a certain level all the time, like a thermostat. It's always trying to keep it in a balance. Say be at this number to this number. Into say me didia, me sugar no kostra, I release something called insulin, a hormone. I release. And think of insulin not like a key or safwa, which opens your cell in your body, so that udidi na say be a sugar bowel system the insulin will open the cell so that glucose and sugar goes into the cell to give you energy, and that's how we can think, we move, and we do everything that we want to do. But diabetes that key is not working as well. It is a key is not working now. Debena sugar is gonna stay in your bloodstream in the vaginal system no. It is a be or check blood sugar no with a finger stick and I say dry blood now. That's how they can pick up say our blood sugars was wrong. And see the process of how glucose na sugar is supposed to work, is there's a dysfunction. It's not working as well as it can. And this would vary depending on the type of diabetes. Diabetes is you will different types, but this is just a general overview. And what are some of the things that can cause it? Into Safuano say if it's not working well, and now you're finding insulin resistance, that's one thing. And now we also have autoimmune disease, meaning say your body attacks your cells. We don't know why it does that, but it does that, and it destroys some of the cells now making insulin. No? And now say there can be some hormone imbalances. And now pancreas helps to make insulin. Say a damage that can also cause or lead to diabetes. And now say there's a genetic mutations to be or some genetic issues that can also cause diabetes. But you'll be seeing on next slide. No? In Titiana Americano said at least just a general overview, no, and then the different types, no. We have type 1, we have type 2, we have something called gestational diabetes. We know you get it while you're pregnant. And then most of the time, diabetes goes away. But I tell my patients, gestational diabetes and say, still I'm our doctor and check it or blood work from time to time, because the type 2 diabetes after I saw our work can come back again. So it's always a good thing to keep to check in A1C level, and I'll talk about that in a minute. And then we have pre-diabetes. So pre-diabetes, ne say your blood sugars was low, but it's not high enough. Say you better consider that as type 2 diabetes. But still, now what's pre-diabetes now? It can turn into type 2 diabetes. And then we talked about, Pacho, if you just go back one more, we talked about say type 2, no, say the body is not using the insulin properly. And then type 1 diabetes, ne say our body does not make any insulin. Here we have to give you insulin for you to survive. And then I'm talking about say you can have some autoimmune condition where I said our body your immune system attacks your cells in the pancreas now and make it insulin and that leads to type 1. And those are just a few of the different types. There are more types of diabetes, but for the purposes of our meeting today, these are the ones that I just want to touch on. The next slide. And then you want to look at some of the risk factors. There are horses who are a bit put you at higher risk of diabetes. A big one is family history. For example, me say my family mo diabetes wo. So already I'm already at high risk to get diabetes. So sometimes it could be say it's not say me and I'm not exercising, I'm not doing all the things. But for the simple fact to say diabetes or my family, I am at high risk to get diabetes in my life. And then if you're overweight or you're obese, that can also increase your risk. You're active, any form of exercise. As you get older, to say we're seeing that younger people are also getting diabetes a lot sooner than before. That age in the crown is changing. And now hormone issues be called PCOS, or even high blood pressure. All of these things can also increase risk for diabetes. But you can go to the next slide. Thank you. She said the symptoms, they don't have any symptoms of diabetes. But these are the big ones in general. No, say I may take you history. Tell me, busa almost some of these are a lot of the times they will answer say yes, they were having these symptoms. So in the medical, we call something the 3 Ps: polyuria, polydipsia, and polyphagia. In Tianono chair say, if you busa patient na beka chel say, oh yeah, I'm always thirsty. If you so come to me, or they have dry mouth. And I say, odidi sa, they're always eating. Even though they are full, they're always hungry. They always feel like they need to eat. And I also say they're feeling tired a lot, and also they're also urinating a lot. So feeling thirsty or also a lot and feeling hungry. Those are the 3 big ones. And then say be our bread all the time. Also say ne vision no assessant. They can't see as well. And also share glasses are. I say so ne eye doctor because ne lenses now mo dia mano no ye. A man should be on so there are more risk for a urinary and a yeast infection. To be say they keep getting urinary infections over and over and over again. But also sometimes sexual problems in memano, or a man also the same. They have sexual problems. And I also so they can get maybe a numbness and tingling and some the hands and their feet. Because the sugars are so high, say it destroy the nerves in your hands and your feet. So that's also another one. So these are just some of the general symptoms. But some people, so mobile hospital and now say me who am I, they will say, I didn't really have anything. So to say they're attacker, and it doesn't mean say if you don't have symptoms, you cannot have the disease. But these would be the most common ones that we see. I'll with me up on the next slide. So the next thing to talk about now is the diabetes complications. This is something that's very important to me because I think that a lot of people don't really understand the magnitude and the gravity of what diabetes can really do over time. So when we talk about say manko for a dram, it's really to help minimize SAR complications is to minimize the risk of getting them because these complications can kill you pretty quickly. And the first one is diabetes can affect your whole body except your lungs. And lungs they mean yet. But every part of your body, diabetes can really affect. So starting with the eyes, if your blood sugars now diabetes is not controlled over a long period of time, the nerve na ewo when near china ebo not to see no called the retina no, it can become destroyed, and that can cause it you can get blind and when be fra. So that's a big thing. Obi also so then they get cataracts and now glaucoma, and also so those are part of it. Inti, that's the first one. Then we move to your mouth. Gums na when ni say no. So sugars no was bacteria no they like it. Nti n'ani gye sɛ wɔfeedi on sugar na ɛwɔ w'anum no. Nti wotumi hu sɛ affect wo gums no na cause gum disease. It can also cause a stroke or even a heart attack. Nti and also so is a big one. The other part of it is diabetes neuropathy and kidney problems. Into sugar no can be high over a long period of the time, say to the point say it can really affect your kidneys, no. But you're sorry, me bano. It can cause it can lead to even end stage renal disease. People they have to go on dialysis because of diabetes, you know. Then we also have diabetes neuropathy, and as I said, they make nerve damage, you know, to your hands and your feet, you know. Obi wants so the diabetes is so uncontrolled to the point saying there can be nerve damage to the feet, you know. Into onya wound afei no onfili na cause bone infection. Ubeti no yes we have to amputate the feet and the hand or whatever. That could all stem from diabetes, uncontrolled diabetes. So you can see say the complications, you know, are really big. Into when we see patients na you recommend a drug, this is part of the reason we are trying to avoid some of these complications. Into as well as say who exercise and a drone for some patients, not all patients, can really help to minimize these things. And obi wɔ hɔ nso so ebi and diabetes is uncontrolled or so any big deal mean family drone. But the problem is 20 years down the line, then you can start seeing some of these, or 10 years down the line. But by then it's too late. When you stroke I can't do anything to reverse that. Into as much as possible, we try to tell patients say it starts now. So diabetes is not uncontrolled that we have to start now to keep it well controlled because we don't want you to run into some of these big issues. So next slide. Into treatment of diabetes. For your presentation today, and I'll touch on the medications kakrebi, but in terms of women's health and just for everybody, all our health, there's more to treatment of diabetes than just edro. So I want to focus a little bit on that. So let's make our next slide. And so the first part of it is so what diabetes is very important. Say check your blood sugars. Okay. Until we know to me who a way for the glucometer. Your prescription, not what where you suit to check your blood sugars. It's important to know numbers now. Maybe our doctor and our provider is hoping to get. In general, we tell patients say, so blood sugar is between 80 to 130 in the morning when you wake up. That's good. And then before lunch, before dinner, before bedtime, we want to see that blood sugar under 180. That is the goal. So if you are not there, we try to work towards it. And then if you are there, we try to keep it like that. Because we also don't want your blood sugar not to go too low. Because if you remember what I said, your body is always trying to keep your blood sugar at a certain range. Tightly controlled, but not too low, not too high. And then we have a test via your friend the A1C. And also your blood worker, and it's an average of your blood sugar over a 3-month period. And then we measure it in a percent form. To be considered say what diabetes that number it has to be above 6.5. And once you have diabetes, our goal is to keep that A1C under 7%. Menu say 7 is good, but I want it lower than that. Because the lower we can get your numbers then I know say the less risk of complications you can get. So long as we can keep it low and safe, that's the preference. And that's what we try to work with people. If you saw me in the street, let me with diabetes, there's not a sign on my forehead I bet catch or say, yeah, my blood sugar, you see. So if you don't check it, you don't know it. It is a blood pressure. When I'm checking your blood pressure, you don't know what your blood pressure is. I can't look at your face and guess. So that is the big part of it. And a lot of patients, this is the first step they always kind of miss. They don't check their blood sugars. In say because our bad doctor's appointments are now bad provider appointments are. If you don't give me the blood sugar readings now, it's difficult for me to guess and change your medication around because I don't really know what's happening day in and day out at home. Blood work now I can do it every 3 months, but remember say me catch must say a average. Inti say average anything in between that I'm not really sure what's happening. So we'll check your blood sugars now or they report to the doctor. It's really important. Inti bachol with me the next slide. Then we talk about diet. So diet is a big topic for many different illnesses. But when it comes to diabetes, no, we don't have any specific diabetes diet. If you Google, you won't see any specific diet that is recommended. Say, be a we used to diet we are, it's fine. But the big thing is say you want to eat healthy meals. You want to eat meals that are also balanced. For me, what I tell my patients is say, you need to eat 3 times a day. In you won't eat anything. Lunch, you won't eat. Then dinner, you eat everything. Into imagine say your blood sugar no pie is 100. Then lunch is 100. Then you eat dinner. Then it's 400. Body is gonna have a really hard time, trying to bring that 400 down. But so to me, stay consistent. Now we eat 3 regular meals now. For the purposes of diabetes, it helps a lot because it's a very predictable pattern. And I would didn't so you want your portions to be smaller. And yeah can Ghana for how we eat yenka mo ho asem. We eat a lot of rice. Nti yemfa say we plate so we do more a full plate of rice. When it comes to diabetes or even in general, a mono should be just like a quarter or 1/3. Not with vegetables. Any kind of vegetables be should be half of your plate. And then it be our protein, say be a fish or say be chicken. Yemfa say it be a udi fufu Ufufu, you want to cut it down a little smaller because that's all carbohydrate, meaning it turns to sugar. So you want to cut that down. Maybe before fufu, maybe I'll wait me some salad kakrebi before you eat. In tiesana, ukodi fufu na you're not as you won't eat it as much because you've already had some greens and salad and things like that. You also want to have fruits and vegetables and then whole grains. And then you want to drink a lot of water. Diabetes likes water. It does not like soda. It doesn't like juice. It doesn't like anything else but water. Intinia eboa. The next one. And then exercise. This is a big one. I know say we're all busy and ibu high and juma samno. By the time I do feel it's very late. But it's really important that we prioritize the exercise. And when you look at what they recommend now, it's 150 minutes of moderate exercise. Moderate intensity means say anything that gets your heart rate up. Okay. Inti so wuko ejuma, that's not exercise. Me busa patients say, do you exercise? So say me ejuma. Yeah, no, that's not exercise. That doesn't get your heart rate up. Inti anoni emphasis 150 minutes. We're breaking it down now. 30 minutes of exercise 5 days a week. Emphasis say Monday to Friday. We get 30 minutes of exercise. You've met your goal for the week. Inti anono, you can do walking. But just walking, or you do it a little bit faster because will increase your heart rate. And then I have some pictures of what other exercises you can do. But whatever works for you is fine. People they like to go to the gym. But as the weather gets better, if you can even just incorporate just simple walking, it makes a big difference. And for the purposes of diabetes, it helps the medications now to work better. It helps our muscles, our cells to absorb those drugs better. So that it can be more effective. And then you also want to do muscle strength exercising as well. Say be lifting weights, be kakra, just to increase muscle strength and then when you're above 65, you want to include some balance exercise and so because we we are more at risk say we can fall and hurt ourselves. You want to do things that will help improve your balance. Say, yeah, you stand on one foot, now we'll try to over balance it, things like that. But nowadays, we use the internet. So you can go on YouTube and then you type in, exercise. And 30 minutes you can stand in your room and you do it. Right now, let's say with Inqualano, I don't have time to go to the gym. But every day I try say 20 to 30 minutes there. Send me YouTube in a mesona and that's fine. And then I just do my exercise and then at least I have something on board. And see, that's going to be very important when it comes to diabetes management and for general health as well. And then you can go to the next slide. And then sleep. Sleep is a big one. But I think that a lot of times, Nayana, we don't talk about sleep enough. So sleep, when you get good sleep, again, it helps our body to reset. And when you have diabetes now, it's really important. So one year, it increases your cortisol levels, your stress hormones in your cholesterol. Those hormones can make your sugars go up. In America, they say your sugar and make you blood sugars no go up. It's hormones in your body where you're stressed out, anemia can make your blood sugars go up. For adults, we really should be getting 7 to 9 hours of sleep daily. I know this may be tough for some people to do, but just remember, say, what decisions that we're making now is going to project your life in the next 10, 15, 20 years. So how do you want to live when you're 70? How do you want to live when you're 80? Is the decisions that we're making right now about your health. And to say one prioritizes sleeper, you will pay for it much later. And see, that's really important. And then older adults, between 7 to 8 hours of sleep, so here. And then you can see that obviously in Kuala they need more sleep than us. So you can go to the next slide. And then lastly is medications. So medications, we have at least 11 different classes of medications that we can use for patients on more type 2 diabetes. And then some people also need insulin as well, just depending on what's going on. Diabetes, patient different. Sometimes just who started them off, it might look the same, but obia journey is different. We don't use the exact same medication for every single patient. It depends on so many things. I'm not going to go into too much of the specifics because this will vary per patient. But one thing I will say is say a do point in diabetes journey now you need to go on insulin now. I try to remind patients to say, and yes, you have failed, and I say one BBA is part of the progression of the disease. Because over time, no side insulin na make us and I say key it's not working as well. So sometimes you need a little bit more help than say pills and kwan. So when they give you insulin it doesn't mean say you did anything wrong. It's just that's where we are, and this is the DRA is gonna really help to bring things down. Of course, with you doing the diet, the exercise, and everything else now, we'll sleep you well, everything else that we're telling you that you need to do. But that's the big thing. And then when you take insulin now, bring your blood sugars down. It can also bring it down too low. Again, it's very important that we'll check your blood sugars, so that you know exactly what your numbers are and what is going on. I'm just gonna leave it at that. Maybe I'll be a specific question about medication, I can answer it. But in general, we have various medications that we can use now for diabetes, which is good. More options for patients is always good. Go and say we keep it as simple as possible. But I think from the provider standpoint, sometimes the patients in the bad na ABI fancy on DDA na on exercise, yeah. Sometimes you are stuck because who send the sugars na cholesterol. Of course, I won't make man to exercise and to eat better. No, sometimes the only option you have is say you add more medications on board. Because what I told you, they say if we don't do something about the high blood sugars, the complications are very high. So that's the thing that I always tell my patients. They say, if you come and you don't do your part now, then by obligation, I have to increase your medication. Not because I want to, but because if I don't and something happens now, then we are all in big trouble. So that's what I would say about the medication part. And if you go to the last slide, I think that is all I have. Yes. So that's pretty much the overview of diabetes for your presentation today. Madam Ase, for your time and your attention. Into some more questions, Ibia, I'm happy to answer any of them at this time. Since the questions so soon so and then I'll turn it over back to Abi and Ata. Thank you guys so much.
Yeah,
no question.
Oh, okay.
Jennifer, that's February. Now we talk about diabetes. Do baby a HMM people no need ifra.
Yeah.
Yeah, me kind my sister. A last one no you know. That or diabetes, but for a long time that no I guess now him.
Mm-hmm.
You know, there was no any kind of medication beyond until later on when it is too late. In
Mm-hmm.
this case, no. Was it because of the fact that that area on annual checkups? Anything that come or what kind of interventions na wo and what kind of science about one who said people way or say way. Now I said between me I attended to now I find solutions.
Absolutely. Yeah, I think that's a very good question. I think that in general, no, getting an annual checkup every year, no, is very important. Because they said they may kind in the beginning, no, diabetes can be very silent. You can go sometimes years. And one thing that is fascinating about our body is saying it gets used to the high blood sugars. In yɛmfa sɛ ɔda bi a wo sugar 100 okay, that's normal for your body. Afei ɛkɔ 200, ɛkɔ 300. Your body will adjust to say, okay, and yeah, that's the new normal. And then it compensates. But over time, of course, say, complications can catch up with you. So I would say definitely say getting annual checkup and getting blood work done regularly, is gonna be key. Ɛba na wɔka no nso so a, when people have diabetes now, when you have type 2 diabetes from the start now, they're diagnosing you now, we tell you, say you need to go and get your eyes checked. And when you go, tell them, say you have diabetes. Because they will do a scan and all the way in the back of your eyes and check the retina na mekano, the health of the retina. No. So that's already a baseline. Inti afei no, wokɔ every year na as you're supposed to now. Sɛ bibi sesa a, ɔmo behu ne ntɛm. But one corner, then it's very difficult to figure out, say, well, when did the eye problem start? Now, no, in at least in America, no, I know said they have they can do laser surgery on the eyes, no, to prevent say any befra, and now said we can give you omoma injections in your eyes as well. A lot of my patients get this to make sure say they decrease the risk say when befra. So those things are already there, but I think so for most people, no, because they don't get things checked and they don't follow up early in it. By the time I'm realizing that it's a little too late. Yeah.
Okay, into say anything free.
That's it. Miss Miss
Side
Awesoro.
injections and then laser, no, does it really work to bring the vision back?
So what they do, they say if they notice that retinopathy is coming on now, then they will start with those injections to prevent say you will go blind. But I think say once it goes blind, then there is irreversible. That's my understanding. Yeah.
All right, that's very good.
Yep, you're welcome.
Miss Awesoro.
Sure.
Concerning exercise na now can. So
Yeah.
me exercise no what them say different free me. And
Mm-hmm.
so meet me nya because diabetes na most of our doctors ne come say free. Na sa sugar ne bitimi e free mu. Na say me
Yeah.
exercise no makoma no bo. Kama na say free me a bitimi nya faso bi was exercise no na.
You can still get the benefits. I have the same thing. I don't really sweat a whole lot when I exercise. But for example, because I use like a watch, Apple Watch now, I notice that my heart rate near cholesterol. So yes, you still get the benefits. Yeah. It's not everybody that maybe you get the sweating and all of that. But of course, you want to try to push yourself so waiting, yeah, to do as much as you can, and also can help. Yeah.
Okay, Jen, Bipacho, Miss Sume, question. Diabetes, you know.
Yes, ma'am.
Yeah, was type 1, type 2, type 3.
Yeah.
To me, I'm breaking it down, which is normal. And type 1, no, numbers ben I type 1, numbers ben I type 2. Samaye. And
Yeah.
power.
Okay. So it doesn't go by numbers per se. I think say it's by blood work and how Nipa present it. So let me talk about type 1 for just a minute. To say the American type 1 say Nipa their body is not making any insulin. And so let me give you an example. Like the other day, my patient came to the hospital, right? Now obaye no na omo checking the blood work and I'm saying sugar was 800. Then me ko hu no na mbusa and say, okay, inti now were you feeling very thirsty? Were you tired a lot? Were you losing weight? Inti for type 1s, a lot of the times what you see is say they're losing weight without trying. To be Habakacho say, I've lost 20 pounds, but my no answer me to when I'm losing weight. So sometimes that is one clue for doctors not to say, is it really type 2 and I say it's type 1? And then the next thing that you need to differentiate between type 1 and type 2 is blood work. So you better check A1C, of course. And then we have some specific almost friend GAD antibodies. You check it because we're trying to see, say, is this an autoimmune condition? And if that test is elevated now, then it can confirm the diagnosis. Some people can start off say be more type 2, no, but then eventually down the line it changes to type 1. So it's kind of tricky, but overall no is the symptom presentation no. So ubana A1C no is above 6.5, you have diabetes. Most of the time, no, most people have type 2 diabetes. And then type 1, not to say they kind no, would be more say making any insulin no. And I know the blood work and they confirm me say you're not making any insulin. And some specific test to be a antibody test to be a check it. Say I don't know what's right. And also confirmation of type 1. Type 3, no, it gets a little bit more tricky, and I don't know, you're more specialist testing to figure out that part. I wouldn't go too deep in it because sometimes it's not clear from the stats right away. Most people is gonna be type 2 that you will see, and then or type 1.
Okay, and that's a pa. Inti
Okay.
A1C no, say bad low,
Yes.
5, about 4, no, the NHS say, we normal. Anna. 5.
So anything above 6.5 is diabetes. So for who are diabetes see a person with A1C coming down under 7. So let's say you get under 5%. Okay. What we have to think about is say A1C near average of blood sugar in 3 months. So 5% is good, but I also want to make sure say your blood sugar is not going too low. And untina unya or average number from to 5. Intina may hesitate to answer that. 5% can be good, but maybe your blood sugar is constantly 60 and 70. 60 and 70 is too low. So it's all a balance. But anything young fans say between to be safe, young guys say between 6% to 7% is great. That would be the goal. Yeah.
Thank you.
You're
But
welcome.
maybe some question I do miss one.
Oh, go ahead.
Oh, okay. So my family history of diabetes. And there was a time I was on the borderline, I think when I was in my 30s, going to my late 30s.
Mm-hmm.
But I did well with the food. So in my 40s, going to my mid 40s, I think I did when I'm check it.
Okay.
Because I'm so aware of it,
Mm-hmm.
of say it's a family history from my mother's side. And thank God, my gestational diabetes, which was great for me. It's
Mhm.
in the borderline. I decided to cut off the rice. Made it cry
Mhm.
so that I portion control.
Mhm.
I'm so conscious of what I eat.
Mhm.
And I didn't want to go and do the A1C because I was so scared. But I decided to go and do it. And when I went, it was so normal. Very
Good.
normal. Very normal.
Good.
Until now,
Yeah.
my doctor they say it's very good. I should keep on doing what I'm doing because. And my question is this: am I going to be lucky not to get it with the food? Because I still go to the I work out. Am I
Uh-huh.
going to luck? My doctor they say I can prolong it, right?
Yeah. I
Because
mean,
me
yeah. I think.
me my meaning the twin sister, no more funny when they were in their early 40s. Both of them,
Okay.
yeah, almost identical, so they have it. The twin sister, unfortunately, we say being an Adventist alone, Mami Fameka, if you know how to follow your DNA,
Mhm.
so I helped when it helped my mom.
Mhm.
But in your name, sir, into call me say vampire, that kind of stuff. Into the new Ebe Fry. I was trying to save the two, but we're able to save one. Now one the
Okay.
crack and the crash, say no, that's all you type two, but say so what shot, right?
Mhm.
What shot?
Yeah.
Because then last one the cry air cut. My question is this: am I going to be lucky because me papa Musa de be new? I will not get it, or am I going to be lucky to prolong it? Because for me, I'm aware of what we have
Yeah.
in the family. Thank you.
Yeah. Yeah. I think that's a good question, and I always like to answer is only time will tell, right? I have no way to predict that. I think say so far Nadia working in here, you're already doing a very good job. Awareness is the biggest thing that you can do for yourself. You know, so you have the family history, so you're working actively to keep your body healthy, you're exercising, you're doing all the things. Ain't yeah, only time will tell. And like I said, sometimes no people they do all the things and they end up getting it. And I try to say, look, don't beat yourself over it. Sometimes we just cannot change our genetics, we can't change it. So I think the best thing you can do is what you're already doing, and you just keep going. And then of course let's say you keep following up with doctor no and getting the A1C checked at least every year. You should know what your number is, and then you spot check blood sugar now no. And then God being so good, maybe you will not get it, but I can't give you a definite answer. Yeah,
Okay, but that's it.
you're welcome. What's your question for Frobi Wom?
Me patch my question. Ebi a minim se waka about it.
Oh, sure.
Bisa se test we no wo fie
Yeah.
who did you how many hours na say we check it?
Oh, yeah, that's a good question. Yeah, until I tell patients to say 2 hours after ubididi, then you should check it, because you want to give time, for body not to absorb the glucose na sugar now we draining anymore. So you can check before you eat, then you can check after you 2 hours after you eat, and then you can see say okay, before I ate my sugar was 100. Okay, now my sugar now go 250. That's a big jump. Oh, until then you can start thinking about, okay, aduane a medi yɛ no, mehwɛ aduane no a carbs bɛn na ɛwɔ mu, and maybe I should lower that carbs no menkɔ fam. Anaa me patients no bi wɔ ha ɔyɛ a ɔsɛ o aduane wei medi a mehu sɛ ɛma me sugar no kɔ soro paa nti, and nowadays I don't eat it at all. But 2 hours is the magic number.
Thank you. Sina kai no cre sometimes the journey bi wo me especially menyem me boys no me
Yeah.
just not diabetes but menyem girl no dey me for some reason. I thank God for that.
Yeah.
Na dem hu ne say me di watch and as me di mutu and katenkwan we are a poison is a
Yeah.
care and I'm 300 nti hu sa
Oh,
no yeah me jai di e boa me.
good. Yeah. And that's all you can do. Say we'll compare, what your sugar is reacting to different foods, because it'll be our body different. And
Mhm.
in your horns as well, more for baby glycemic index. Depending on the kind of food, no, it's me raising with sugar no by a certain amount of points. In a brown rice, bema with sugar cholesterol by, I'm just giving numbers, 20 points. But maybe a white rice would be a bema cholesterol 60 points. So then what will you do, right? Ebia, you eat more brown rice, and I say ebia white rice no ubedin so kitwebi. So that's some of the things that when people have diabetes, we hope to teach them along the lines, because the food is a big, big one when it comes to the management, Yeah.
So, and I'm one thing to say na me yes, and na me di more carbs, but me di more kind of protein, which is meat and beans. No, no boy, but na me tired, na me meat nipa,
Yeah.
which is kind of so you know what like yes, and I meat no. Me to was what I say.
Yeah, I mean, I think so will be a meat now. Like for example, say be a chicken, right? You want to avoid like frying it. Maybe you do baked, and I'll be air fried. Fish, so the same thing, right? Because you want to minimize that cholesterol part of it, With me, a different type of beans. With me, a chickpeas. I think you just have to explore like protein options how you can do besides just meat. And that can be tricky for us sometimes. But the beans, the legumes, those kind of things are a little bit better off than meat, But so obedi meat, just maybe avoiding deep fried. Sometimes they bread their meat, You don't want to do that. Just eat the fish, put it in the oven just like that. You don't want to add any breading or anything like that, because it extra calories and it makes your cholesterol go up too. Yeah.
Me pacho me wasem bisa
Yeah.
Jennifer. Nyame fro. Masem bisa yetu. Dedi kan ni say. Diabetes nkwa na ma o sugar level no echo high na say yare foforo wo ho a ebetimi ama o sugar level no call high. And second question also say, say wo train ma doctor eka say wenya biansa na wato we ya check o sugar na say obetimi a start ya check so wo bi so ne bi.
Yeah, I mean, with me, I check it, whether you have diabetes or not. But I think that the biggest thing is the understanding of numbers. What does the numbers mean? Because if you're checking and you don't understand the numbers, now that can be a big issue. So that would be the first part of it. As far as other things that can cause, so sugar cholesterol, I'm trying to think. I think I think said diabetes. There's some other hormone issue, be diabetes insipidus and stuff like that. But those are a little bit more beyond my knowledge at this point. Um, yeah, that's the only thing that comes to mind. Yeah, it would really be diabetes now. Amount like your blood sugars go up. That's gonna be the big one. Um, the other thing I can think of is ibia sabi omuma wedrobi to say steroids are it can make your sugars go up. Let's say you don't have diabetes, but wakoye surgery be and they gave you some steroids, and also can make your sugars go up. But I know you're quick. Your sugars never cost through there, but it will come down. And then it's fine. But if fans say oh diabetes or mama with steroids now, then it can really make your sugars go up. So those would be maybe just a few things that I can think of right now. Yeah.
Me pacho metimi abem kakra. Say
Sure.
my asem ne kakra na ataka ye no. Na me say yeah there was say education is me gidi say yambo acha de nyina ye be kwa akototo.
Yeah.
Ya check ya hwe. Na osi ehu numbers na me bisa say obeti atre say be a range ni ye say from say so that you check you on say be wa no so makoma atomi yem
Yeah. Yeah.
ye me gina ne and I said ye me gina ne nye.
Okay. Yeah.
Okay.
So I believe, say, if you check in for say in the morning now, between 100 to 125, yeah, between 100 to 125, no, is pre-diabetes. And then if it goes up, I'm gonna say 126 or higher now. And again, this is consistent numbers. We check it one pair, that's not helpful. So you have to keep checking it, consistently. And then I believe if it's one, yeah, my numbers, yeah, I'm mixing it up. Let me double check and then I'll tell you in just a minute. I don't want to mix up the numbers while I'm patcho. Let me just confirm the numbers. But I know so 100 to 125, no, consistently would be, we're worried. We start thinking about pre-diabetes. And then I think 126 and up, no, Then if you start seeing that consistent, and maybe I was sorry, be at 126 and higher, we start worrying a little bit more about pre-diabetes. But you need to do the A1C test, your doctor will do the A1C test to confirm. That's how it is. Into under 100 nadia is normal. Does that help?
Me pa cho me da se pa.
All right, thank you.
May the mother can be we are serious so we infection now we have first year. Raise sugar cost. Mostly we are so stress more. And now check sugar no also. Yeah, in pre-injured say more diabetes. But if everything being oil pure, let's say consistently, what check with sugar level, not the committee, it really high. Something is going on, I would say. And I dear about also see a channel. It makes sure, say, sugar kids, I won't feel.
Actually, sound is a little far away.
Sugar kids, I will feel because sugar, the BLT is which means hypoglycemia. Put a book on the tank, it's me too, if you will, no, we did. What okay, no, I can get that so. But to me, so hypoglycemia, we should go or some baby, so we won't tell them, a young lady say, we need sugar or hypoglycemia. Hypoglycemia kills faster than hyperglycemia. It will always be also who say, oh, a 6 day be say a 6 day keep, say a fruit juice. Anything be a containing sugar, say the way out of it, it's you as a fossil and Sanaba, it will be at the wire at the work of hospital. Yes, as also be a million said, so control sugar here. Doctor Sin do along the camera, insulin or the camera, a Ghanaian who dietary who control the camera. This say complication of diabetes, 77 retinopathy, any peripheral neuropathy, when we cataract, say in Pukran, when you get aging time, those who many that and answer on a sample of who they don't obey the treatments the doctor the man when insulin only metformin on the doctor catching the be and one come to diet and so they say like would be on exercise not one sample of one in the young community that sample of one in the muting it possibly be say to and the difference between type 1 diabetes and type 2 diabetes, we say type 1 diabetes, no body need produce insulin at all. And until we hear compensatory, and I say artificial insulin. See, I don't know now why doctor more insulin for type 2 diabetes, no body need produce insulin, but it is not enough. It is not enough to most type 2 diabetes, no, you don't share sedentary lifestyle. Any dietary treatment, any oral medications, be a metformin, so on him control the year, and you get insulin back up. Most of the media, be a insulin, or hospital, and prescription insulin be a letter for type 1 diabetes. But one doctor said, we need the year, then what do the year, then what do necessary for type 2 diabetes. Someone wants and you get insulin, I can't remember the type 2.
Yeah, Mpacho, yeah, that's it. I just want to clarify just two things I will kind. As far as a low blood sugar or hypoglycemia, the kind is very true. But let me just add on a little bit to that since you said, oh, low blood sugar now and no blood sugar now you're under 70. What symptoms? Symptoms may say be you are feeling shaky, you are sweaty. I said like come de kakra, like you're hangry kind of thing, bisa you feel confused and now you're dizzy. Those are all symptoms of low blood sugar. The first thing I will be is check your sugar not to confirm said number near under 70. And the uncle kind is excellent. You can buy glucose tablets and sugar tablets from CVS, Walmart, wherever. Obefa 4, it tells you on the thing. Uchiwi 4 of them are, that's a treatment we have for the low blood sugar. And now say 4 ounces of juice. And now 4 ounces of regular soda. Or honey, so you can do just a tablespoon of honey as well. So those are some of the options I will be to use to. But I think the Uncle Kaine is a good reminder of what to do in a low blood sugar. Into fast treatment now, you want to wait 15 minutes because you want to give a chance to body nenya sugar no to bring the sugar up. Now I repeat blood sugar ni bima confirm it's a number na basro above 70. Say ambassador, then you treat again. The obesa 5 year sugar no 4 tablets, and now say juice no, and now say honey no, and now just if you require or candy because with fear you can do that. Into number 70 now, you want to eat some food, I hope protein to sustain you. And that's very true. Just to add on to the difference between type 1 and type 2, no, I think that's very true. But nowadays, no, what we're also seeing is because people are not coming to maybe a doctors early enough to get blood work and stuff early, no. We will have by the time I be able diagnosing with type 2 diabetes, now it's been many years, it's been going on for a long time. So sometimes they do have to start people with type 2 diabetes also on insulin. So I just want to make that clarification. Say people that have type 2 can also be on insulin. Type 1 diabetes, you absolutely need to be on insulin. If you are not on insulin, you can die. That's how serious it is. But type 2, no, nowadays in my experience as I'm seeing, no, we are seeing more type 2 people no needing insulin a little bit sooner than first, no. First, no, lifestyle changes, maybe a statin pills, be near sheko. But now, sometimes for some patients, no, we are having to start that insulin a lot sooner. I just wanted to just add those 2 points to what Uncle just said. Yeah, that's it. I don't know. It's a question be I mean, sure more time so more finish it up. Yeah.
Mepacho obi foforo wɔ question wɔ hɔ a okay. I think say your time no aso nti obi any question anaasɛ mmoa bia a yɛbɛda yɛ sister Jennifer asese yɛto nsa frɛ no one opportunity na ɔde adesua kɛseɛ sei abrɛ yɛn. Mpamkyɛw yɛn nkyɛn ho no moma yɛn nyinaa yɛnka tie ne nneɛma mpaeɛ. Yɛda wase ade nyinaa so tumfoɔ sɛ waka wo mma ho na ɛnɛ yɛtumi san bɛhyia mu ɛbɛsua wo ho adeɛ. Yɛsrɛ wo sɛ boa yɛn na deɛ yɛtie ne nyinaa no yɛntumi mfa nyɛ adwuma na yɛnsua biribi mfiri mu na yɛmbɔ yɛn nipadua a agyapadeɛfoɔ wode maa yɛn ho ban sɛdeɛ ɛbɛyɛ a yɛbɛpie wɔ soro yɛbɛtumi de ho akontabuo ama wo. Yɛsrɛ sɛ wɔn a wɔantumi ama no ma yɛntumi mfa adesua yi bi nnuru wɔn nkyɛn na obi biara ntumi nsua biribi mfiri ɛnɛ deɛ yɛsua yɛn ho. Yɛsrɛ sɛ yɛrekɔdeda yi bɔ yɛn ho ban na ma ade pa nkye yɛn na sɛ ade pa kye yɛn a ɛkyɛ Nyankopɔn boa yɛatumi asan ahyia na yɛde adesua yi di hɔ nso abɛka ho na memenda yɛn nyinaa yɛsɛ yɛatumi ahyia wɔ asɔre de awieɛ no koraa atoa so. Yɛsrɛ sɛ ka yɛn ho na bɔ yɛn ho ban na wɔtwe mu a bɔne bi ama yɛn ho wadom nti amen.
Amen.
Pamkyɛ mpanyinfoɔ
Amen.
ebɛgya ha ama mo.
Yo, Jenny, nyame nhyira wo bebree, woayɛ adeɛ pa, nyame nhyira